All right, hello folks. It is July 8th, Thursday, and this is going to be the recording for the review for the Therex final exam. I did the midterm for the final exam for the kinesiology earlier. This is the final for the Therex exam. So this is a big question, what's going on with Therex exam? Again, as I said, for the kinesiology midterm, the Therex exam should be 100 questions. It's about 75 right now. I'm going to bump it up to 100 because I feel that I need to get you guys more prepared for your national boards. I know you may not like the extra questions, but in the long term, you will thank me for the extra questions, as it will give you the ability to actually have more points on that final exam. So what's on the final exam? Well, the final exam is going to start from the very beginning of the semester and run all the way through the end. What kind of questions can be on it? Well, let's start at the very beginning, and that's talking about those foundational concepts of Therex. You know, the idea of what is balance versus cardiopulmonary endurance versus stability versus mobility, right? You've got to be stable before you can be mobile. And then you can be stable and mobile, and then you can develop skill. Remember that kind of functional tree that goes along there. Where does your job as a PTA fall for maintaining the safety of the patient? You know, what is the ICF, right? The International Classification of Function. And then also the breakdown of the ICF. What is an impairment in body function? What is an impairment in body systems? What is an impairment in body structure? And what is an activity limitation versus participation restriction? You should be able to break those down. How do contextual factors play into the ICF? You know, are there environmental factors that could affect the patient's ability to improve? You know, what is disability? What does that mean to people? How do we make good decisions on how to treat a patient? Hint, hint, the evidence-based practice model, right? Who sets up the plan of care? Hint, hint, the PT. Right? We implement the plan of care. Do we make changes to the plan of care? No, we do not make changes to the plan of care. We can make changes within the plan of care to the exercises as long as we stay within the plan of care, but we cannot edit the plan of care itself. What is a discrete versus serial versus continuous task? What's a closed versus open environment? Right? What are the stages of motor learning? Cognitive, associative, and then autonomous, right? What happens if we practice parts of what we do versus practicing the whole of what we do? What happens if we practice exercises and then practice functional activities, right? Which one of those is going to lead us to getting better? What's an intrinsic feedback versus extrinsic feedback? How do we provide feedback to the patient? Should it be all at once? Should it be broken down? Should it be at the end of the session? Should it be at the beginning of the session? Here's a hint, varies by patient. What's the difference between health, wellness, and kind of public health? Can you have a overall healthy well-being yet still have a medical condition? And then we looked at patient supervision and observation, right? Understand all of the people on the rehabilitation team. What's an audiologist? It's a nurse, psychologist, those type of things. What's an open versus closed-ended question? How do you assert dominance without being bossy? How do you express warmth? What's the difference between sympathy and empathy? Right? How do you measure change? Hint, it's in the measurements we take during the therapy session, whether it's pain, whether it's edema control, whether it's manual muscle testing, range of motion, right? Do we make plan modifications to the plan of care? I'm going to say this again, no. Are there specific things that a PT can do that a PTA cannot? By the guide to physical therapy practice, are techs allowed to treat patients? What are our core accountability and values according to the APTA? Altruism, accountability, compassion, excellence, integrity, professional duty, social responsibility. how do the systems interact with all those abilities to help the patient? What's inflammation? What's temperature? You know, what kind of changes the skin color can we know? What are blood clots, edema, all those basic stuff. Documentation. How do I document a SOAP note? What is subjective, objective assessment and plan? What goes in what, right? Subjective is what the patient states. Objective are numbers. Assessment is what you see, and plan is what to do. Then we did foundational concepts of Therex. Know those exercises. Those are going to be your first day in lab anyway. Know what a pelvic tilt looks like. Know what a posterior pelvic tilt versus an anterior pelvic tilt is. Know what abdominal bracing is. Know all of your setting exercises, the most basic Therex we can do. Quad sets, glute sets, ham sets, right? So know all of those. When we talk about range of motion, right? Active versus passive versus active assist, right? How do we perform those techniques? What might prevent us from performing those techniques? At the hip, right? What kind of stuff do we have down there? Know your hip precautions for anterior and posterior hip. Understand how fractures occur, right? Know a lot of those hip pathologies that are there. What would be the purpose of distraction of the hip? Actually, what would be the purpose of distracting any joint or versus compressing it, right? Distraction, pain relief, compression for stability. At the knee, understand the screw home mechanism. How does the Q angle affect things? What does a total knee replacement look like? What bones are being replaced in a total knee replacement? Why are we doing total knee replacements? Usually to repair damage due to osteoarthritis, right? And then for all of those, all of the joints, not joints, yeah. Let me focus. For all of the joints and parts of the body, what's the difference between the maximum protection phase, the acute phase, the moderate protection phase, that subacute phase, and the return to function phase? What do we look like? In that maximum protection phase, it's a lot of passive range of motion, right? And education to protect the patient. What are the different problems that can occur at the patella? Right? Patella tendonitis, those type of things. What are the different types of surgical grafts we can use? Maybe a brief idea of why we might use a brace. Right, a brace is an orthotic that helps provide stabilization. At the ankle and foot, again, know your bones and stuff like I told you about in kinesiology. You need to know those forever. What kind of nerves exist in the foot? What is tarsal tunnel? What is a triple arthrodesis of the foot? What joints are being fused? What's an inversion versus eversion sprain of the ankle? What's pes cavus versus pes planus versus hallux valgus? Plantar fasciitis. Ooh, is it painful? Shin splints, medial tibial stress syndrome. Right? What is the most common ankle sprain? What is a high ankle sprain or ankle syndesmosis injury? All those ligaments of the foot again. What is compartment syndrome? Because the ankle is where we started talking about compartment syndrome. How does that relate to CRPS? What is a bimalleolar versus trimalleolar fracture? What does open kinetic chain, or actually for all the joints, what does open kinetic chain versus closed kinetic chain look like for all of the joints? What are our steps for balance control? Ankle, knee, suspension strategy, hips, step. What's the difference between static seated surface versus dynamic seated surface versus static sitting versus dynamic sitting or dynamic walking? What kind of devices can we use to challenge balance? What's the most simple device we can use to challenge balance? Well, that would be a pillow, right? What's the difference between eyes open and eyes closed? What happens when we do that in balance? What's fibromyalgia look like? What's myofascial pain syndrome look like? What are some of the precautions for low back surgery, as well as total hip replacement surgeries? When we have nerves and soft tissue damage, what does that look like? Right? What would a median nerve distribution look like versus an ulnar nerve versus a radial nerve? What are adhesions? What are the degrees of sprains and strains? What is an ectopic ossification or heterotopic ossification? Understand your stages of inflammation and repair. How long does it take for a bone to heal? Know your nerves, know your plexes. And again, I'm not going to ask you to draw your plexes. That's not what I'm asking. But know where they're located at. Dermatomes and myotomes. I've told you before, you need to know them until the end of time. I'm going to ask you questions about them. Seed and Sunderland scale, don't worry about it. I'm not going to probably ask you any questions on those. What is a nerve mobilization? Why are we performing it? What can happen when we have a brachial plexus injury? Right? What is thoracic outlet syndrome? How does it get tested for? Adson's, Roos, and Allen. What is carpal tunnel syndrome? How do we test for it? Balin's, Tennell's. What is ulnar compression? How do we test for it? Tennell's. What is CRPS? Understand both types of CRPS, CRPS1, CRPS2, and also CRPS not otherwise specified, meaning I don't know which type it is. What are some treatments for CRPS? All right, the hand injuries I talked about. Know what a carpal tunnel versus de Quervain's is, versus Boxer's fractures, versus Smith's fractures, scaphoid fractures, Dupuytren's. Know all of those hand conditions. You do not have to be able to look at a picture and diagnose it, right? The diagnosis is a PT, but you do need to be able to describe them to me. PNF, know a little bit about the history, but mainly know what kind of the definitions are. What is an agonist versus antagonist? What is approximation versus traction? What is manual versus verbal cueing? Know your reflexes, meaning myotatic versus inverse myotatic. Know where the Golgi tendon organs are located at versus the muscle spindles. What is irradiation? And then have a general idea of your patterns. So if I give you a specific kind of idea and say that this is the self-feed pattern, you should know that's D1. Know the basics, really basics of those different types of PNF that I talked about, rhythmic initiation versus rhythmic stabilization, that type of thing. Don't get too hung up in the weeds here, please. I'm not going to specifically ask you what the difference between an agonist contract versus an antagonist contract, what should be in the name, right? Agonist, agonist, antagonist, antagonist. Just say it. Know your aquatic therapy kind of terms, buoyancy, Pascal's principle, those type things. What are indications, contraindications, precautions to aquatherapy? What should you have the patient do as soon as you get them in, before you get them in the pool? Repeat. What's the difference in temperature regulation? What is specific heat? With what type of patients would you want to use a warmer pool versus a cooler pool? How often should be a pool tested and cleaned? What about life preservers? What are the requirements? What about CPR? What are the requirements? What kind of stuff can I do in the pool? Well, you can do almost everything you do in the land. With the spine and the extremities, what's a tight muscle versus a stretch weak muscle, right? Peripheralization versus centralization. What is the anterior pillar of the spine versus the posterior pillar? Again, spinal disc type ideas. What happens if I have kyphosis, lordosis, or scoliosis? How many curves can I have with scoliosis? What happens if I get a compression injury of the spine? What should I do before I do any active motion of the spine? I should stabilize the spine. With the aerobic versus resistive exercises, that was the asynchronous lesson we talked about. Make sure you understand your energy systems. ATPC versus other ones, right? Know your slow versus fast twitch muscle fibers. With resistive exercises, make sure you understand when is appropriate age-wise to do resistive exercises. When is it not appropriate to do resistive exercises? What is the difference between an open kinetic chain versus closed kinetic chain? What is the difference between isotonics and isokinetics? What are you doing when you work in isotonic exercise? If I asked you what a lowering of a weight would be, is that an isotonic exercise or is that an isokinetic exercise? If it's an isotonic, what type of isotonic exercise is it? Know the difference between passive and active insufficiency. That should be beat into your head at this point. That includes me asking you how to put a muscle on passive or active insufficiency. If I say something like the quadriceps, and I'm just specifically saying vastus medialis. Well, vastus medialis's only job is knee extension. That means to put it on shortened, I need to extend the knee. To lengthen it, I got to flex the knee. But what if I've got a two-joint muscle like rectus femoris? You have to take into account all the motions of rectus femoris in order for passive and active insufficiency. There are several pictures of those exercises, of basic exercises that you have to identify. They are very, very easy to identify what the patient is doing. It'll say, name this exercise and have a picture. Like a person standing at a chair and raising their heels. Should know what those are. So those are going to be your questions on your basic exercises. So again, about 100 questions. That's it. I will try to get the Kahoot up here shortly. Other than that, if you have any questions, please reach out to me. That's it for the review for this final. I'm not going to give you the exact questions. I'm sorry. You need to start studying. I will catch you guys later. Thank you. And this has been the review for the TheraX final.